TMS is suitable for patients who have significant depressive symptoms and are not getting better with other treatments. Usually if you haven't responded to 2 antidepressant medications or you're having trouble tolerating medications due to side effects, TMS is likely to be a suitable treatment for you. Hopefully you'll get better. We can't guarantee that, but at least 50% of the patients we treat get substantially better with TMS. Probably another 20% or so get some benefit, but we're really aiming to try to get a complete resolution of your depression. That's the ideal outcome. A treatment each day takes about 35 to 40 minutes. You'll need to have a treatment Monday to Friday, 5 days a week, from somewhere between 4 and 6 weeks. By about halfway through treatment, patients will often start to notice an improvement in their mood, but most people will require at least 20 sessions to get a really substantial effect in the treatment of their depression. When patients come to us for the first time, they're often fairly anxious because this is a new and unusual procedure. However, the vast majority of our patients are really pleasantly surprised at how easy the treatment is and how well tolerated it is. It can be uncomfortable for a very, very small subset of patients, but it is extremely rare that we have a patient who doesn't go through with a course of treatment because of any physical discomfort or any concerns whatsoever. TMS is generally very well tolerated. It can be a little bit uncomfortable. Some patients describe it a bit like having a little woodpecker sitting, tapping away on their forehead. However, there are things we can do to adjust the position of the coil and how strong the treatment is, and it's very rare that somebody can't get through a course of treatment. Some patients get a little bit headachy afterwards, but even that's fairly rare. You can certainly have somebody come with you to treatment, but it's not necessary. As soon as your treatment is finished, you'll be okay to leave the clinic, go back to work, drive if necessary. There's really no restrictions on what you can do afterwards. Well, our aim is for you to have a complete resolution of your depression. At least half of patients will achieve that, and another 20% or so will get improvement without their depression going away completely. We hope that that benefit then lasts long term, but we may wish to use TMS or other treatments to help sustain your benefit in the months and years after you finish your treatment. The most important thing during treatment is to stay still. If you're able to read or listen to music or to talk to the person administering your treatment, that's fine and shouldn't affect the success of your treatment. Patients' experiences during TMS vary, but most commonly about halfway during treatment, patients who are going to respond often notice a lightness or they notice some improvement in their thinking in particular. Then gradually over time, the rest of their depressive symptoms improve. Sometimes there's a few ups and downs along the way, but hopefully by the end of the treatment, patients are feeling substantially better, much more able to function, go back to work or take up their normal day-to-day duties. I've been doing TMS since the early 2000s. I originally started doing research studies and was somewhat sceptical about whether TMS was going to work. I was really surprised, pleasantly so, when patients started getting better. And over the years, as we've improved the way we do TMS and we've seen better and better clinical responses, my enthusiasm for the treatment has grown to the point where I think it has real capacity to make a major impact on many patients' lives, which is why now I think TMS needs to be much more widely available for patients throughout Australia and around the world.